Testosterone replacement therapy can definitely be a game changer for men with low testosterone, but to be fully optimized, to get the most out of it, we have to look at things beyond just your testosterone levels. TRT can trigger kind of a cascade of changes in your body, and if you're not careful, you can end up with more problems. It can affect your estrogen, DHT, and other things that can have effects on other organs that maybe you're not wanting. Issues like sleep problems, blood pressure, blood clots, and even erectile dysfunction, oddly enough. So while the aim with testosterone replacement therapy is to boost your levels and optimize your levels, it's vital to understand that it's not just about one hormone, it's about achieving the balance between all the hormones. Hello and welcome. My name is Dr. Taranella, and this channel is all about helping you optimize and improve your health. Today we're taking a deep dive into the ripple effects of testosterone replacement therapy on your endocrine system. If you're finding this information useful and helpful, please hit that like and subscribe button to continue getting videos like this one. With TRT, we're introducing exogenous testosterone into your system. And while this can alleviate some of your symptoms, it can also disrupt the delicate balance of the other hormones in your body. For example, you might experience elevated estrogen levels, DHT, or problems with cortisol, and even suppression of your body's own production of things like luteinizing hormone and follicle-stimulating hormone. These shifts, while sometimes beneficial, if they're not carefully managed, can create unwanted side effects and potentially worsen your overall health. And so understanding how testosterone replacement therapy affects these other hormones is critical if you want to, for instance, minimize the side effects like mood swings, hair loss, prostate enlargement, or sleep disturbance. It's also important if you just want to have a more optimized result in terms of feeling your best and achieving optimal health. So we can think of your hormonal system in general, your endocrine system in general, as a finely tuned orchestra, and each hormone plays a different instrument in that orchestra, and they need to be basically in harmony with, we don't want one that's overbearing all of the others. Otherwise, it's going to sound out of tune or not quite right. And so TRT is enhancing one of those instruments, and it's enhancing an instrument that's not quite working as well as it should. And this is good if it brings it up to the level of all the other instruments. With too much, though, on one side, it can lead to lopsided results and those other systems not able to keep up. And so we need to understand how this new instrument, or enhancing what's not quite right, is going to interplay with some of these other players in maintaining the overall performance of your body. And so that leads to the mistake that often occurs with testosterone replacement therapy. A lot of times they only focus on the testosterone levels, thinking that more testosterone is going to make them feel better because a little bit made them feel a little bit better. Even more is going to make them feel even more better. And they overlook the importance of monitoring and managing the other hormones, potentially leading to side effects and vicious cycles of more leading to more problems. So for instance, a common scenario I see with patients on testosterone replacement therapy is initially they feel great, but recently they've been having more issues since they increased their dose. They might be having more irritability or heart palpitations or difficulty sleeping. And their doctor kind of convinced them that his levels have been checked and they were, perfectly fine. However, upon further, more careful inspection, we find that his testosterone dose is just a little bit too high, and estradiol or other levels are also just a little bit too high, or perhaps a little bit too low. We address these things, and pretty much like magic, things improve. Now, that's not always the case in every scenario, obviously, but I have run into this many times. Just a little more careful look at things can really improve how you're feeling day to day. And so the big obstacle is just the lack of awareness and attention to the detail of the subtlety that sometimes goes on with testosterone replacement therapy. I'll share some of those things with you. It's not like a magical special formula. So if you made it this far, you're probably wondering, which hormones do I specifically need to check and what levels are going to be optimal? And we're definitely going to get into that. First, what happens if you have too much testosterone in general, exclusive of these other hormones? Well, of course, the TRT, the goal is to raise your levels, but excessive amounts can increase the risk of side effects. And part of that is from the testosterone itself, but it's also going to lead to higher amounts of DHT, higher amounts of estrogen, and it can lead to issues in your hematological system. You can get polycythemia, increased production of red blood cells, and that can lead to increased risk of blood clots. Testosterone increases the amount of oil production in the sebaceous glands, leading to acne, which can be on the face or back. There's oftentimes mood changes too with really high levels of testosterone. Specifically, it's going to more commonly lead to anxiety or irritability, but sometimes this can also be related to estrogen levels. Sleep disturbance, again, when your testosterone levels are optimized, you should have better sleep, but sleep definitely can get worse, especially if you have existing sleep apnea, and especially if you're pushing those levels of testosterone just a little bit too high. It's going to possibly lead to more waking up in the middle of the night and could be from sleep apnea as well. So when your testosterone goes up, there's several things that are downstream metabolites of that testosterone. And one of those is dihydrotestosterone or DHT. And DHT is about 10 times as strong as actual testosterone. And so it's natural for that testosterone to convert into DHT. The problem with DHT is it can lead to a lot of loss of your hair on your head. And so you're going to get that typical male pattern baldness, but it's not going to happen overnight. It usually happens over time, several years into the process. And DHT is also one of the hormones that can stimulate prostate growth and enlargement of the prostate. So in some cases, DHT can also contribute to urinary symptoms. And there is some connection with prostate cancer, although the link there is pretty limited at this point. And if you want more information on that, you should check out my specific video on testosterone and its link to prostate cancer. DHT, because it's an androgenic hormone, can also increase the amount of acne that you're having as well. Estradiol is another thing that can go up with testosterone replacement therapy, and really it should go up. You don't want your estradiol levels too high, and testosterone again turns into estradiol and DHT. A little bit is going to go to both, and it's kind of dependent on your enzymes and how efficient those enzymes are making that conversion, and that's genetically determined. But too much estrogen can cause gynecomastia, water retention. With that water retention, you can get increased blood pressure. Erectile dysfunction can also be common with too high of estrogen levels. Mood swings as well, hot flashes, prostate enlargement. High estrogen is just really not a good thing, so you want to make sure you're controlling your estrogen. I do recommend using a more specific test for estradiol levels, which is called the ultra-sensitive estradiol. It is the estradiol that's liquid chromatography mass spec. It's just going to be a little bit more accurate at picking up those estradiol molecules. That's more important for males because they don't produce a lot of estrogen in general. Cortisol can be another issue, and the relationship between TRT and cortisol is not fully understood and a bit complex, but some studies do suggest that testosterone can influence cortisol and how your body responds to stressors. I've definitely seen this in my practice where someone had normal cortisol and then they go on the testosterone and it's much higher. Does it happen in every case? Absolutely not. But it certainly makes sense too in the context of sleep disturbance. And testosterone too has a little bit more of that adrenergic stimulation, which is linked with cortisol and the fight or flight hormone system. So it's not surprising that you're going to get more cortisol production when you have higher testosterone levels. And so with that higher cortisol, you're more prone to sleep disturbance, anxiety, irritability, mood problems. And there sometimes can be metabolic effects as well, such as like how you're storing your fat and how you're metabolizing your glucose. So naturally, we think that when you're on testosterone and testosterone replacement therapy, that you're just going to start producing tons of muscle and the fat's just going to kind of go away. Yes, that can be true to some extent, especially if you're exercising, but it's not going to happen in all cases. And especially as those levels of testosterone creep up above the reference range, that's when you're potentially going to have some of this effect on your cortisol and make you more vulnerable to maybe the opposite effect that you're going for. And then lastly here is FSH and LH. These are the pituitary hormones that stimulate the testes to make testosterone and spermatozoa. And so when you're on testosterone, your levels are going to give a negative feedback to the brain to downregulate the production of those. And that's going to lead to more testicular atrophy and reduced fertility in general. And sometimes people can have symptoms from the testicular atrophy, like achiness in the testes. And of course, if you're thinking about fertility, then for sure you want to have your levels checked. the higher your dose of testosterone, the more likely that that's going to happen. It does not happen in every case, but certainly happens in most cases. And I have other videos on fertility and how to get over that if you're on testosterone. So you might want to check those out if you're interested. So it's important to note the degree to which these levels are going to be off is going to vary significantly from person to person. And the main factor is going to be your dose. But of course, genetics, body composition, age, the type of testosterone you're using, and the overall health status of your body is important things to consider. And so that's where personalization and customized testing of your testosterone levels and estrogen, DHT, and all these other things come in, and you want to be doing careful monitoring so as not to fall into these problems. A lot of times when we start someone on testosterone replacement therapy, we're going to check within 6 weeks of them being on it and then another couple months down the road. But sometimes these problems show up 12 months or 18 months down the road after you've been on it for some time. So it's important to stay diligent with your testing. So we're going to get into some specific numbers in terms of what you should be shooting for. First, let's cover a little bit of research here on testosterone side effects. Studies definitely back up the fact that the higher level of testosterone, the more likelihood you're going to have problems like specifically polycythemia, DHT, elevations, and hair loss. There's no question that running higher testosterone levels over a long period of time is going to likely lead to much more hair loss. So yes, TRT has a broad impact on your overall endocrine and hormone system. And so that just further emphasizes the need to monitor things carefully. So what I recommend doing if you haven't started testosterone replacement therapy is you want to get kind of a before and after picture for some of the things that you're most concerned about. And so that would be all the things that I already mentioned, like DHT, estradiol, using the mass spec liquid chromatography. Sometimes sex hormone binding globulin is important to run. Well, I don't always do that. CBC and a metabolic panel just to make sure blood sugar levels look normal, and A1C and lipid panel and CBCs. The CBC is going to be monitoring that red blood cell count, and we want to get a baseline before you start because we want to be following that over time. If you're already high, sometimes you have to be even more cautious with the dosing. In some cases too, if you're someone that already has higher stress levels or difficulty with sleep, you might consider getting a cortisol level done before getting on testosterone replacement therapy so that we make sure it doesn't run too high after you're on it. And so usually after 6 weeks, 8 weeks, you're on the testosterone, you want to get follow-up labs on all these to make sure they're not too far outside of what you're shooting for. So some of the numbers that you might be looking at when it comes to your estradiol, for instance, should be in the mid-30s to mid-40s. Would be kind of the optimal range, and that's in picograms per ml. Luteinizing hormone, if you're concerned about fertility, that's going to be typically, you're going to want to see that closer to the upper range. But if you're on testosterone replacement therapy, you're probably not going to be able to get it into the upper range, but at least within the normal range of 1.8 or 2.0. And then testosterone itself, you're going to want to look at the free or bioavailable testosterone, and you're looking for somewhere around 150 to 200 picograms per ml. And that is going to change a little bit based on the lab. So sometimes you're going to need to move the decimal point over 1 point if you're using like LabCorp, which I think is nanograms per ml. So keep that in mind. Cortisol, typically you want to see that around 12 to 15. And when it starts creeping much higher than that, that could be a signal that there's a problem. Hematocrit usually is going to be an issue when it starts to get over 50, but for sure when it's above 52. And that's on a percentage basis. And usually the red blood cells are going to go along with that. They're going to start increasing as well. So those are kind of the targets that you're going for with your testosterone replacement therapy and corresponding other hormones. In terms of DHT, it's really just going to matter how careful you want to be about the hair loss. And if you're worried about prostate issues too, you're going to have to dial back your testosterone dose if you want those levels to go down. Now, sometimes when these things are high, you can use medicines that can help ratchet these things down and still keep your dose the same. So for instance, there's aromatase inhibitors that's going to reduce the amount that your body is generating from the testosterone. And the most common one that's used is called anastrozole or Arimidex. There's also natural alternatives that I do use sometimes, but they seem to not work nearly as good as that anastrozole. For the DHT, there's 5-alpha reductase inhibitors, which I generally don't use or recommend using because they can have some negative impact on your libido and sexual function. They certainly do have a role, and for sure putting it on topically on your scalp is probably the better move if you're worried about hair loss and you really want to be on the testosterone replacement therapy. But it's really a judgment call in what you feel comfortable with. In terms of increasing your luteinizing hormone or keeping that fertility rate high, usually what we're going to do in those cases when you're concerned about that is to take some HCG. HCG, human choriogonadotropin, is going to help stimulate those testicular cells to continue to make the spermatozoa. Sometimes Clomid or enclomiphene can be useful here too, although I don't think it's as strong or as reliable as the HCG. To get the most out of your testosterone replacement therapy, you want to make sure you're exercising regularly. That's going to expand or theoretically at least increase the amount of androgen receptors in the tissue, so you're going to get more out of the testosterone that is going through your body. Stress management, getting proper sleep is also important for making sure cortisol and the rest of your body is just working at its peak optimal level. So if you're considering testosterone replacement therapy, or maybe you're already on it and you want to make sure you're on the right track in terms of your dosing and some of these lab metrics, I'm in the process of creating a guide to testosterone replacement therapy that addresses some of these specific issues. It provides in-depth information on optimizing your testosterone replacement therapy, what levels are going to be best for you, and how to minimize the side effects. It goes into a lot more depth than this video does. And when it's ready, there'll be a link in the description. You certainly can also check out our testosterone replacement therapy playlist. There's a lot of videos on testosterone replacement therapy, so be sure to check those out as well. So now that we got all those details out of the way, here's the key takeaways that I think are important. The first one is that TRT doesn't just affect your testosterone, it also affects lots of other hormones too, like estradiol, DHT, sex hormone binding globulin, but cortisol, luteinizing hormone, and even other areas of your body. Those hormone changes can lead to certainly good things, positive things, but can also cause problems or side effects that you probably don't want. And that's where also individualization or customization of your dosing comes in, which includes increasing, decreasing the weekly dose or how often you're taking it, and also whether or not you're using some of these other supplemental things to manage those other hormones like estrogen, cortisol, DHT, etc. So if you're having problems, for sure, you want to get a more expanded panel that looks at these. Even if you're not, I would recommend doing these kinds of tests periodically. Remember, testosterone replacement therapy isn't just about raising your testosterone. I mean, of course, if your main goal is bodybuilding, that's probably the main thing you're going to be looking for, but that's not generally the reason to go on testosterone replacement therapy. It's about optimizing your entire body, making sure your tissues are getting adequate amounts of testosterone, but not too much. Now, one question you might have after watching this video is, what really is the optimal dose of testosterone replacement therapy? Is there a range? And you can find more information on this video here. It's an old one, but a good one.